Hi everyone, this is Kate Warnock coming to you from the GuideWell UST Global Innovation Center here in Lake Nona. I have a wonderful guest with me today, Dr. Prakash Patel. Prakash, welcome to the interview.
Thank you, Kate.
So Prakash's role, of course, is Chief Operating Officer for GuideWell. You know, Prakash, just a couple weeks ago, you and I met and we were talking through GuideWell's strategic approach to keeping a very patient-centered focus, yet containing costs, especially as we deliver cancer care. Can you maybe highlight for us some of those points that GuideWell does take in that strategy?
Absolutely. It's great to be here. Getting a wonderful conference,
Yes.
wonderful gathering. There's a number of things that we're doing. One of the areas that we're focusing more and more on is prevention and wellness. And I know Pat's talked quite a bit about this with you earlier.
Yes.
You know, the Better You and a number of other wellness programs are a very important part of our strategy because obviously the first place to start is to prevent cancer diagnosis in the first place. As we move along the continuum, we're now partnering more and more, and we also talked about this before, around the value-based relationships with our oncology providers. Mm-hmm. So moving beyond just the treatment episode, but thinking about what can we do to encompass wellness, the cancer therapeutic, follow-up visits, perhaps rehab, other community services, are really partnering with the right kind of providers who have that mindset of thinking about the individual in a holistic way and thinking about the patient in the continuum of care. Mm-hmm. So getting the right providers in our network is another part of our strategy. We're also leveraging best practices and benchmarking against what are the best providers doing? What are based on outcomes? Obviously cost is a factor, but if you look at the outcomes, we're finding that those who have the best outcomes often don't have the highest cost. So cost and outcomes are not always correlated, but leveraging best practices can help us to drive to those things. We're also leveraging the pods, the provider groups that we talked about before. We have the place of delivery services. We have 11 of those, as you know, throughout the state. And we launched them in January 1st. And today I'm really pleased that the teams have done a great job and we're seeing wonderful results. And again, that's about working with providers and the patients and consumers on a localized basis and leveraging all of those resources that are available, and that's been a very effective strategy.
You know, I'm going to stop you just for a moment because when you were sharing about these places of delivery, that little acronym that you mentioned, POD, the thing that strikes me the most is the fact that it's comprised not just of the clinical team, but you have social workers involved there too.
Absolutely.
You have pharmacists, you have people that are really there.
Behavioral health specialists.
Behavioral health, so you really truly are enabling that holistic approach to this individual who is going through such a challenging time in their life, and you're providing those resources when and where they need it.
That's right. And Kate, then we take all of these pieces and we have to create products that are affordable. And you know, very big push that we've been delivering on and will continue to evolve is making sure that our products meet the demands of the full continuum of the needs for all Floridians. Mm-hmm. And you know, the My Blue product we put out on the exchange this year is just an example of that, and we're going to continue to evolve that and expand those kinds of offerings.
All right, so Prakash, our next question for you then. You know, obviously here at the Greater Than Cancer Immersion event, there are a lot of different people that are sitting in that audience, and they really represent all different parts of the healthcare industry. Why is it important for GuideWell to collaborate with people like this to help improve the cancer patient experience?
Well, if there's any disease or any condition that better reflects the need for community and collective thought, I can't think of anything more than cancer. Cancer is not a single event, and because it's not a single event, there's not a single approach. And cancer also affects every facet of an individual's life. And so we need the collection of individuals to come together, different industries, and we're seeing that. It comes, you know, we have the data folks here, we have diagnostic, the pharmaceutical, obviously the health plan, consumers, the provider community, all the various therapeutic approaches. That's what it's going to take for us to be able to really address the terrible disease that cancer is, but we're also seeing better and better survivorship because of this community coming together and working together to address cancer.
You know, and as we address cancer, Prakash, I know that really the most important piece of this event is really what happens after that hyphen, which is the other side of cancer care. So in your opinion, what does that look like?
I think that it's about the journey, and we spend a lot of time thinking about transactions, and at least historically we've thought a lot about the transactions, and what you've seen over the last couple of years is we become a health solutions company. We've been thinking about the journey that and the experience that the consumers, our patients, undergo. So for us, and there was a very powerful statement that one of the speakers made, that curing does not equal healing, and healing doesn't necessarily equal curing. So I think we have to remember that. So this is the whole idea of supporting an individual before they have a diagnosis, during the diagnosis, after the treatment start, after treatment stop. There's also a need for community support. There's still the prevention piece and wellness and connectivity with different services. And I think that's what we're spending more and more time. So I think the other side is when we think about the individual in a holistic way and offer up services that can meet those needs.
All right, well, I think that GuideWell, under your leadership, is really going to be so well positioned to help contribute to that other side of cancer care. So, Dr. Prakash Patel, thank you so much for joining us. My name is Kate Warnock. Thanks for watching.